So I think it started off when I was going just way back to my medical training that I was a first year resident, meaning that I had just graduated medical school and started on call as a pediatrician resident. And on my first night of service, we had admitted a patient who had, had some changes with his eyes and his vision. And at that time, he had also been at his grandfather's funeral and had just was acting inappropriate, laughing, and the family couldn't figure what was going on. And so he got admitted to our service for an MRI because they couldn't get an MRI that night. So we admitted him, and I was talking with the family, and I think I didn't know what was being considered at that point. And the next morning, I saw, I'd worked all night through the day. It was 30 hours, and my attending, the person that was in charge of our team, was crying, and I kind of went to ask what was going on, and it turned out this young man had a brain tumor in his brain stem, and it's a tumor that's completely at this point incurable. It can't be surgically removed. There's been hundreds of trials that have never generated any significant improvement in survival, and the only thing we know to do is radiation. And so I just was devastated. I had no idea this was even being considered. And so I went in with the neuro-oncologist came, and she walked in the room, really didn't get to know the family, and said, your child has a brain tumor that will take his life in the next 6 to 10 months. There's nothing we could do about it. Take him home. And she went to walk out the door, and I swore to myself this would never ever happen to somebody or a family. It would never be that way. And I started reading about it and reading about it. And about 2 months later, I had somebody else came in with the same thing. And I knew so much more at that point, and knew about trials and things, not to just to send them home or have this lack of compassion to talk to families. And I think just my interest in has been grown from that. And, coming to Mayo when I was looking for, so I, I really love taking care of these kids and their families. I feel like this is a group that really needs a lot more therapies to make survival better and life better. A lot of different pediatric tumors, we're able to take care of the tumor and they go back to life, or they have some modifications. This is the brain, and so someone's taking out the brain, portions of the brain or areas of the brain, and have therapy to their brain, and it changes them. And I've always enjoyed these patients and tried to work with families, and I feel like my personality has lended well to these kids. And I think that's where my passion first developed, and it's just built from there as we see, the big need for new therapies and novel therapies to improve. Leukemia used to be a death sentence in the 1960s, and now it's over 90% survival. And so brain tumors, we need to get there. And so I want to be on that forefront with the team and coming to Mayo was a big push with, Dr. Mahajan, Dr. Locke, Dr. Daniels, Dr. Keating, with all experts in their fields. And so it's been a fantastic move for me, and I'm thrilled to be here. Yeah. So I do have some experience. When I was before in Nebraska, there was an organization there that really looked to fund just research in the state of Nebraska so that they could keep more of the patients home, instead of having to go out to other places. And so here, with Proton, we have Proton here, and so we're able to do a lot of therapies to reduce the toxicity to the patients in the long term. With that, as well as having new protocols here that are using targeted agents, so personalized medicine, to target the tumor and less likely to target normal healthy cells. So that's a great development. Another thing is Dr. Daniels in his lab is doing great things with high-grade tumors like diffuse intrinsic pontine glioma, that he has a trial that now is through going through the FDA, looking to see feasibility, and the drug company about offering these to our patients. We're also part of a group called the Neurofibromatosis Consortium. So it's a group of a few hospitals throughout the country that offer novel therapies for children with neurofibromatosis. Neurofibromatosis is a condition that causes a predisposition to cancerous tumors or low-grade tumors. And so these now some of these aren't necessarily life ending, but they're life altering or they're vision threatening or, lots of learning disabilities. And so some of these therapies to target these tumors for these children to give them better quality of life. Um, in the last 30 years, a lot of our we call low-grade tumors or tumors that grow slowly. Generally, we've turned that into more of a chronic disease versus a disease that is life-threatening, although it still remains. But for many patients, they're able to deal with their disease and either have it removed or treated with chemotherapy and sometimes radiation. So now we're moving into more targeted therapies for these or finding molecular mutations, all to help. And so research is critically important because research is the forefront of moving therapies forward. I always like to tell every time I approach a patient when we're on hospital, when I'm here in the clinic, I do 100% brain and spine tumors. But when I'm on hospital service, I'm trained as a pediatric hematologist and oncologist, so I see all the leukemias, I see solid tumors, I see hematologic issues like blood clots. But when I'm on service, anytime somebody has a new diagnosis, one of the things we talk to families about are trials. A trial is something where we know there's a standard of care and we know the outcome from that. And then there's also like an experiment. There could be an experimental question of, is this agent with another agent, will that improve survival? Or will this agent, now we've seen that survival is so good, can we reduce the therapy a bit to give less toxicity? And so that's kind of at the patient level how we're continuously doing that, is that it's sometimes hard because you're just meeting a family and then you're talking about some medicine to try and make things better. But I always talk about that there's people before and children before who've come along that have helped the kids along the way. And so that's kind of the research, how we're doing it at the bedside, because we're always, but then there's, Dave and the scientists and we call it sometimes the basic and the translational scientists that are taking and drug discovery and bringing it to the forefront so that I, as the physician, could then try and apply it to the patient. And so it's been very exciting that we have another several. I think we've had 7 or 8 new trials since I've started in the last year, and we've just papers. I don't think it's signed with an ink yet, but have another neuro-oncologist that's coming. That's a senior person and a translator who does a lot of clinical trials. And so I think we'll have lots more to offer here in the state. And we're lucky here in the state of Minnesota that we have 2 partner institutions, Minneapolis Children's and the University of Minnesota, who also have lots of trials for children, and collaboratively, I think we work all very well together. That's what I wake up every day with, because you tell it's a real good conversation ender when someone asks you what you do,
Yeah.
and so
Yeah.
sometimes I'll just generally say I'm a pediatrician, or it depends on the environment, because it's like, oh, I'm a neuro-oncologist. Oh, what's that mean? Oh, I take care of children with brain tumors.
Yeah.
Quiet.
The
Oh,
end.
it's blank face, and so, but then, there's lots of people that you could talk to about what you do, and you get to say how hopeful a time it is, because it really is. I always go back to my leukemia example that, like, again, really, I was watching, I don't know if you ever seen the show MASH. Um, but MASH I loved, and I remember they had an episode, and this was the 50s, 60s, uh, and so there was a gentleman who had gotten one of the episodes where he got leukemia, and everyone was just broken and that he was going to die. And then we look at our data, and really there really wasn't good therapies, but because of these trials and putting together, that was a good thing I should mention too, is there's something called the Children's Oncology Group, and that's the biggest consortium of research around the U.S., as well as I think in Australia and Canada. Um, But basically, if say a particular type of tumor that we take care of is very rare in the pediatric, we see maybe 250 a year in the United States. And so, but if there's one in Seattle, one in Rochester, one in Florida, you know, seven in Texas, you know, it's hard to say, do we give everyone, how do you, you know, unless you're all talking on the phone and saying, we tried this, because maybe there's not a good cure for it. But then we put everyone together and said and created a way for everyone to communicate so that someone could say, you know, a kid like leukemia, a kid with croup, gave steroids, and all of a sudden his leukemia got better. And so it's like, maybe we should try giving steroids to some of these kids and see what happens. And so that's kind of now, and I would say I've been tremendously thrilled that the pediatric neuro-oncology field is a very supportive, helpful, collaborative group. We're small and mighty. Whereas I think, you know, you get into some other kind of areas of medicine and it's cutthroat and it's competitive, and there's protectionism of information and not willing to share. And I could tell you that I've never encountered that within our field. I you know, if I have somebody that we've worked through a lot of the standard therapies and the diseases keep returning and I'm out of good thoughts, it's not infrequent that I, you know, write a group of colleagues and say, I've tried this, you know, here's what this looks like. Any thoughts? Anybody have anything out there that's not in a trial, but any thoughts or treated anybody like this? And I get tons of emails back, or that, you know, or we're going to publish a paper. It's not been published yet, but we did these kind of things. We expect it to be published in a month, but you may want to try this, you know. And so, I mean, it's fantastic. It's a, I think we see a lot of terrible things. We see a lot of great things. We see miracles, but I know that our group as a whole work together to do things for kids, and that's special.
Yeah.
I mean, I see all the time. Every once in a while, I'll see it might be friends with a former patient or something on Facebook, and they'll post something and it'll show up on these brain like support groups, and I think those are wonderful, and I'm so happy for them, for families. Uh, only I'd like to thank them for the support that they've given to the families here in the state of Minnesota and outside the state. I'd like them to know that their generosity and their funds have gone to help programs to really translate from the bench to the patient. And we really hope that that gets to continue as we get better and better at our jobs and learn more how to take great care of these kids and get them to live long lives and healthy lives and productive and happy lives.
That was wonderful.